Welcome back. Thom Hartmann here with you. And on the line with us is Dr. Lawrence Schlachter. He is a neurosurgeon, a lawyer, the author of Malpractice, a Neurosurgeon Reveals How Our Healthcare System Puts Patients at Work. His website, Larry Schlachter, SCHLACTHTER.com. You can tweet him at LarryMDJD. And Dr. Schlachter, welcome to the program.
Good morning, Tom. Thank you for having me on the show.
Sure. You've been a friend of Congressman Price for 40 years. You say you know him and you know what he's all about. I'm reading this political website here, American Bridge. It says Thomas Edmunds Price, his net worth is $13.6 million. Tom Price's entire political life has been driven by one goal: profit off taking away millions of Americans' health care. As HHS Secretary, Price would shamelessly work to destroy the Affordable Care Act, scrap Medicare, and privatize Social Security. He traded $300,000 worth of medical stocks while pushing legislation in Congress that would impact medical companies' share prices. He wants to privatize Medicare and take away benefits from millions of seniors and future retirees. Also supports gutting Social Security and Medicaid benefits. Why should this guy be in charge of our healthcare system?
Well, Tom Price, I know, has always been a very fine physician with integrity who took excellent care of his patients.
Yeah, I had a doctor who performed surgery on me about 3 or 4 years ago, and we got into a political conversation, and he started talking about chemtrails. I mean, just because somebody's a doctor doesn't mean that they're even rational necessarily.
Well, Dr. Price's political agenda. Firstly, I haven't spoken to him in years, so anything I say, you have to take in that context. Okay. I don't know what he's thinking. But when he lived here in Georgia and he was a state senator, he was the force behind tort reform in Georgia back in 2005.
So he wanted to make it harder for people who had been injured by doctors to sue and get compensation for that injury.
Absolutely. I mean, he was very much in favor of policies that would reduce patients' rights to get compensated for injuries, which I take the opposing point of view. Without any personal comment about him, we just have different views on the subject.
Right.
So the Georgia Supreme Court found the important parts of that law unconstitutional and reversed them.
Mm-hmm.
So we do not have caps in Georgia at this point in time, so people can be compensated for their injuries in full.
And just FYI for our listeners, this whole tort reform thing, Texas actually did this, and they successfully passed a $250,000 cap on medical torts, claiming that it would reduce their healthcare costs, and it had absolutely no impact on healthcare costs whatsoever. Yeah.
So this brings me to the point of my book, which is an expose on patient safety, and in Texas they had to reverse or amend the Constitution. The actual costs of malpractice litigation and expenses is under 0.5% of healthcare expenses. So in comparison to rising healthcare costs and profits and stockholders of insurance companies and pharmaceutical companies, it's a non-issue. So part of this whole repeal of the ACA, in my opinion, is sort of a smokescreen to then try to convince the public that there are frivolous lawsuits and that we should have tort reform.
Right. They've been pushing this thing for decades.
Federal tort reform.
Yeah.
Which is just not fair.
Yeah. Well, historically, the two groups that have been major funders for the Democratic Party have been trial lawyers and unions. And Reagan declared war on both, with tort reform against the lawyers and with, right to work for less laws against the unions. And both those have had some success over the years. But how does that...
Tort reform is against the patients.
Yeah, I know.
What happens with tort reform is the patient gets victimized by the injury that should never have happened.
Yes.
And then they get victimized again by not getting compensated and having to go through the angst of trying to get compensated and then finding that they're barred from doing so by some law.
Right. Plus, you have a much smaller pool of lawyers who are willing to take on that tort, that injury, because it's been capped out at what they can get. So that they're going to have to be rather modest lawyers for the rest of their lives if that's the kind of law they're going to practice.
Well, what happens is people who are retired or disabled or underage, they no longer have a good case because the economics of taking the case are destroyed because the caps are on non-economic damages, and they have no earnings to start with.
Right, right. So they've got nothing to say, hey, you took away the rest of my life. So,
right. Now,
so
if the same person got hit by a truck, it'd be no limits to,
well, that's because it would be the truck's insurance.
Fairly compensated.
Right. Yeah, because of the liability insurance of the, because of the way our car insurance laws are written. Although that will vary from state to state. Different states have different regulations with regard to that kind of thing.
Yes.
But I'm curious your thoughts on Tom Price. He's being grilled by the Senate as we speak. Actually, I think they're in a break right now. But I mean, over this course of these hours, and his repeated statements, efforts, and votes to basically deny healthcare as a right to people, instead clearly define healthcare as a privilege, and a privilege that you really have to earn by being wealthy in the United States.
Well, I saw Senator Sanders ask him that question a few days ago, and he didn't answer it. He went on to answer something else.
Right.
He talked about access.
Right.
Rather than a right. My personal opinion is that everybody deserves access to health care.
Well, Reagan took care of that in 1986 when he signed the law that said that emergency rooms can't turn you away if you're not insured.
Yes, that was a good thing.
So literally everybody in the United States has access to health care if you call an emergency room health care. But access is not the issue. It's health coverage, good comprehensive health care.
And you don't want to wait until you're sick enough that you have a crisis that you have to go to the emergency room.
Right.
And you don't want to overload the emergency rooms with non-emergencies.
Right.
So what we have here is a situation where the Affordable Care Act really has economically failed. It just hasn't worked. The intention was good to insure everybody, but the compromises that were made it not work. So
do we get the health insurance company? I mean, you still have Stephen J. Hemsley, the CEO of United Healthcare. He's made over $1 billion off that company. His predecessor, Dollar Bill McGuire, took home $1.6 billion, had to pay back $200 million of it to the federal government because of apparently some kind of fraud involved in the way that he was taking his stock options. But every penny of those billions of dollars that were taken by those two CEOs at United Healthcare, every penny was made by saying to somebody, no, we're not going to cover your liver transplant, or no, we're not going to cover your breast cancer surgery. What you're really touching on is how much economic incentive should there be for the doctors, for the hospitals, for the insurance companies? What profit margin do they deserve to make? And how regulated or unregulated should the whole system be? Or should it be for profit at all? I mean, Switzerland does not have a single-payer healthcare system. They're the only one of the OECD countries that doesn't have something close to a single-payer healthcare system. England also has socialized medicine where they own the hospitals and pay the doctors directly. But pretty much every other country is a variation of single-payer. But in Switzerland, everybody is required to have health insurance. The cost of health insurance is tax deductible, and the health insurance companies and the hospitals are required by law to be not-for-profit organizations. So the prices are very, very low. They've got, some of the, it's more expensive than most European, quote, health insurance or health care, but Switzerland's one of the wealthiest countries in the world. But it's still far, far below the United States simply by making them not-for-profit. I was running a business in Michigan in the 1970s. I remember we had 18 people working in a factory in Okemos, Michigan, outside of Lansing. And Blue Cross Blue Shield at that time was not-for-profit. Every single hospital in Lansing was not-for-profit because that was the law in the state of Michigan in the early 1970s. And it cost me $35 per month per employee to cover their entire families. So where are we headed? I mean, what's going to happen now? We're probably 5 days into a new administration. This whole thing is going to come apart. I wrote in an editorial today that got published that there are several things that would be politically toxic that can't be eliminated. You can't take insurance away from people with pre-existing conditions. Right. You've got to have portability where if you switch jobs, you can take your insurance with you. Yep. You got to be able to insure your kids up to age 26. But beyond that, apparently they want to take it apart and rebuild it in such a way
that there'll be block grants to states.
Which means that during recessions, states are going to have to cut back on health services to their people because there will be no more federal money forthcoming, but unemployment will be rising and more people will be falling into poverty.
Exactly. And the care of the lower socioeconomic folks will diminish. One of the possible solutions is to have a two-tiered system, one like Switzerland where everyone's got insurance, and then a second system where people can go buy more insurance.
Oh, well, all the countries that have single-payer systems, there might be a few exceptions, but Canada actually used to be an exception until about a decade and a half ago. Canada now allows private health insurance. They didn't for a while. But all of them allow very wealthy people to buy health insurance policies that get them, a single room instead of a ward or instead of a double in a hospital, catered meals, jet airplane, private jet flights if you're injured outside the country, all this kind of stuff. I mean, I have no problem with that. But as primary care, most of these countries make it illegal for anybody on a for-profit basis to offer primary health insurance. We're like the village idiots here. I don't get it.
I'm 68 years old, and 3 years ago I went on Medicare. So my physician was no longer able to practice. You know how many doctors I had to talk to before I found one that would even talk to me about becoming his patient?
I don't know. I went on Medicare about 5 months ago, and I've had back surgery since then. I've seen probably 7 doctors. I've never had anybody even blink when I say I'm covered by Medicare.
Well, yeah, but for me to find a primary care doctor who actually would take me into his practice, I had to talk to 12 people.
Wow. What state do you live in?
So I'm in Georgia.
Yeah.
I live in Atlanta. So what that means is that the compensation level was so low for Medicare or for Medicaid.
Well, then why are all the doctors in D.C. perfectly happy to see Medicare patients? Are you sure it's not ideology?
I think it's probably a matter of competition and patient load. And, maybe there are more doctors per capita in the area.
Oh, no, it's the exact opposite. When we first moved here, my wife needs Synthroid. She's got hypothyroidism. And we could not find a single GP in this entire city, and she made well over dozens of phone calls who would see her within fewer than 4 months. We ended up going with a concierge doc simply because it was the only way to immediately see a doc. Which is, but it's anyhow.
So what's happening is a lot of the docs are getting squeezed, and they're being forced to give up their private practices and then work for institutions.
Yeah.
And when they do that, they have no more control over their nurses, their secretaries, their office policies.
So why not simply lower the Medicare eligibility age to 0 and ban for-profit, like pretty much every other developed country in the world has done, ban for-profit primary health insurance while saying to the health insurance companies that exist, hey, if you want to offer for-profit secondary health insurance, no problem.
Well, that's one of the solutions, and that would be something that would not be going along with the present administration philosophy, obviously.
Well, unless Donald Trump really and truly, if his ego is driving him so much that he wants to be loved and wants to be popular, I mean, as I'm sure you know, the most popular man in Canada year after year after year is the guy who invented their single-payer healthcare system up in Saskatchewan. Kiefer Sutherland's grandfather, I'm forgetting his name, Tommy something. Tommy Douglas. Thank you, Shana. So, if somebody could convince Trump that this would make him insanely popular and he could call it, rename Medicare Trump Care. Anyhow, Dr. Lawrence Schlachter, a neurosurgeon and lawyer, author of the book Malpractice, a neurosurgeon reveals how our healthcare system puts patients at risk. LarrySchlachter.com, the website. LarryMDJD is the Twitter handle. Thank you, Dr. Schlachter.
Thank you. Nice to talk to you.
Good talking with you, too.
This is the Thom Hartmann Program.